I'm going to talk about a fairly new technique or method that we recently published for the rapid yet on-site identification of infectious agents called pulse-controlled amplification. And I'm just going to go ahead and we're going to go right in. And this is probably something that you've heard a lot already. So the project started with an all too familiar problem. So we were also looking for a rapid on-site diagnostic test, which would be able to fulfill 4 basic requirements that we were looking for. So we were looking for rapidness or speediness, along with portability on the one side, and also sensitivity and specificity to ensure a reliable diagnosis on the basis of which we can actually initiate a therapy on the other side. So we started thinking, what do we already have in our portfolio? And when it comes to speediness, I'm sure everyone is always thinking about the same thing, rapid diagnostic tests such as lateral flow assays. I'm sure everyone is very familiar with them. Everyone has probably used one at some point. They're widely used. They're very popular because they're indeed very fast. They don't take much time. They're light, they're small, and you can take them basically everywhere. Which is good. However, it is well known that they do lack sensitivity and specificity. When we look on the other side, so techniques that have a very high sensitivity and specificity, of course, the PCR comes to mind, which is, well, the gold standard technique with extremely high sensitivity and high specificity in most cases, but it's rather limited when it comes to rapidness. And when I say rapidness, we're always thinking about like 20 minutes is good, no longer than 30 minutes. And as well, of course, portability. So essentially, anyway, so essentially we set out with the aim to find a technique that would combine the advantages of RDTs with the advantages of PCR. So a technique that would fulfill all of our 4 basic requirements at the same time. And what we found was something that is now called pulse-controlled amplification, or PCA. And the important part is that this technique identifies pathogens by amplifying and detecting nucleic acid. So it's a genome-based method, just like PCR. And actually, it also follows the basic principle of PCR. However, as we will see in a few minutes, it's just much faster. And at this point, I would like to point out that this technique was initially developed by a German startup, GNA Biosolutions, and they approached us, they introduced it to us. So this whole work was a collaboration of our institute with GNA Biosolutions. And what you can see here is a basic schematic of the technique. So the basis of the whole technique is a reduced thiol modification at the 5' prime end of the primer. It can be either the forward or the reverse primer. And this allows for a very strong thiol-gold interaction, which then eventually lets us immobilize our primer, our modified primer, to gold, as in gold-coated wires, for example. And the technique is essentially a chip-based technique. This is a picture. This is almost the size of the actual chip. It's maybe a teeny tiny bit bigger. And so this is a prototype chip. It's a plastic chip, and it has 8 cavities. And the wires are located at the bottom of each of these cavities. And then PCA also uses thermal cycling, just like PCR. However, instead of the rather time-consuming alternating heating and cooling of the whole reaction mixture, rapid energy pulses are applied to the wires. So eventually causing ultra-fast local heating events just around the wires, which are used for denaturation, while the remaining bulk of the reaction is always kept at base temperature. So in the end, with PCA, you have all the basic steps of a qPCR. So we have annealing, we have elongation, probe hybridization, etc. But each cycle is very, very short, and thus we can run a very large amount of cycles in a very short amount of time. And eventually, this reduces the total time of the amplification process by a factor of up to 10 when we compare it to standard PCR. And just like qPCR, the amplification can be traced in real time using either intercalating dyes, or in our case, we use our standard hydrolysis probes. And what you eventually end up with looks like this. So a result that looks very familiar to us. It's very similar to PCR, qPCR result. However, this run actually only took 13 minutes from start to finish. And now, obviously, you're going to need a cycler to run PCA in. And this was the original prototype. It's called the Pharos Micro. It's very lightweight and it's battery operated. And it was really specifically designed for field use. So you can see it's rather small and it's very, very simple. It basically has like an on and off switch, and you have the lid at the top, which you just open, and you can, this is where the chip goes, you close it, and you can basically press start. This would be a picture of an actual setup in a tent where we tested and used the device really under field conditions. In the background, you can see that we use a tablet, a portable tablet that is connected to the device to evaluate and analyze the results, and of course track them in real time. And the prototype assay sort of, so we started out with a proof of principle assay. So please keep in mind, this is a proof of principle assay, but we use this for the detection of Yersinia pestis. And you can see some of the basic parameters of the assay right here. So we decided to use the PLA target as a multi-copy target. And you can see the primer design in the table below. And you can see that the necessary thiol modification was added to the forward primer. And the overall size of the PCA product is 81 BP, so it's a fairly small product. We used a constant base temperature of 66 degrees. And we ran, in the end, we decided to run a total of 550 cycles with a cycle time of 1.5 seconds each. So that brings us to a total run time of about 13.5 minutes. And then from the very, very beginning, we tried to optimize everything for field use and really under resource limiting conditions, such as, of course, for example, limited cooling capacity. So we designed and only used freeze-dried master mixes, which can be kept at room temperature, temperatures up to 40, 50 degrees without any kind of degradation. Also, an important issue for field use is always sample preparation, such as, for example, DNA extraction, which can be a very limiting factor, both time and resource-wise, of course. So we designed the assay to work with crude sample material. So no prior preparation is required. However, we did use an initial 5-minute pre-incubation step of the sample, but that pre-incubation step is performed inside of the chip already at base temperature, so you need no additional equipment for that. It does add another 5 minutes to the total time, and then including pipetting, we're looking at a total time of about 20 minutes from start to result. We ended up, or eventually, we analyzed 3 different types of samples. We did start out with purified DNA, which is, of course, as I just said, not our target. However, we did use it for the first phase for assay optimization and etc. We then moved on to crude liquid culture material to see how it would work with not prepared DNA. And then eventually we tested sputum samples spiked with Yersinia pestis. I'm not going to go into the very details because the time is not enough to talk about all of these samples, but you can see it works quite well with all of them. And you can see the respective limits of detection shown here. Very briefly, of course, we also evaluated specificity because that is always a problem. That can also be a problem with PCR, of course, whenever you work with primers and such. So I'm not going to go through the whole list, obviously. I just want to say that we luckily did not detect any kind of cross-reactivity. And I just want to point out that this was also true for all close relatives of Yersinia pestis, such as Enterocolitica, Fredericksonii, pseudotuberculosis, and also others. And of course, as I know, this is a lot of information all at once. If you're interested in the essay itself and more details, you can just check out the manuscript. And now I hope still I'm on the time. I'm going to come to an end. Just a brief outlook. What do we want to do? Of course, we want to further optimize the technique, the method. We certainly want to establish more assays for other pathogens. And we want to develop new protocols for new matrices, both patient and environmental. And just as a side note, like everywhere, then Corona happened. So we were actually able to establish another assay pretty quickly. So we established an assay for the rapid detection of SARS-CoV-2 using PCA, using crude swab material. So that works really well. And we get really good, reliable results in just under 25 minutes. So we were very excited about that. And so in the end, we're pretty confident that we have found a technique that is sort of like the overlapping area between RDTs and PCR. And we hope that we can, or that this technique might be able to evolve the field of rapid diagnostics, especially under resource-limited conditions. And with that, I'm at the end. Thank you very much for your attention. And I'm sorry that